Think prevention, live long.
I'm Dr. A.J. Shah. You just had an ultrasound of the carotid artery done, so I'm going to explain the results and we'll go through all the details in person, but I want you to watch this video so that it's easy for you and it'll be definitely much more understanding for you when I come and explain you the results of carotid ultrasound. So let's review the arterial system of the body. So heart is in the center. The main artery which comes out of the heart is the aorta. And aorta will give branch to the right arm, and it will give a branch to the brain. And brain has total 4 arteries coming out, and I'll explain to you in a second. And then it will give out an artery to the arm. And then aorta will continue to travel behind the heart to the legs. Again, this is obviously schematic, so you just can understand better. So brain gets 2 main arteries we call carotid arteries. Right and left arm get its own arteries, and those arm arteries give out small branches, one from each side, and they go to brain also. So as you see, there are 4 total arteries going to the brain, 2 carotid arteries and 2 vertebral arteries. When the carotid artery develops blockage, this is the normal artery. This is the way normal artery will look like. When it develops blockage, the plaque buildup, we can see it in an ultrasound to see how the flow is going through the blockage area. As the blockage gets worse, you can see now the blood flow has to make a space around it and then keep going. And then eventually the blockage is completely blocked. The blood just cannot go through it. The main concern we have with the carotid artery is not the blockage, but a tiny clot forming at the blockage, and that clot itself getting a little loose, and that clot traveling to the brain and plugging up one of the tiny brain artery and causing a stroke. So again, the plaque is important, but eventually it's a tiny clot. Eventually it's a tiny clot which kind of get loose and go and travels towards the brain, plugs up one of the brain artery and causes a stroke. We know now, based on the last 25-30 years of experience, that when the blockage is 70%, 70% is or higher, chances of having a small clot going to the brain and causing a stroke is very high. So I will explain you how much of the blockage you have in your carotid artery. If it's 70% or more, whether you need to have any further testing done, including a CAT scan with a dye or MRI with a dye, to see if the blockage is complex or blockage is concerning enough that it can cause a stroke, that it will require either a surgery where we clean out the blockage, or nowadays we can even put a stent to open up the blockage. Sometimes when you have a blockage approaching 70%, we might decide to put you on additional blood thinners. Typically you will be on aspirin, but we at times will put you on Plavix or other type of blood thinner to prevent, again, if you remember, that clot forming at the plaque and then traveling to the brain and causing a stroke. Again, to sum it up, you had a carotid ultrasound done. If the ultrasound shows serious heart blockage, we will talk about whether you need a CAT scan or MRI or not, and eventually whether you need a surgery or a stent placement or not. If blockage is below 70%, we will continue to watch it. You will be on aspirin. At times you will be on additional blood thinner, and obviously we'll talk all this thing in detail in person, which applies to you, specifically you. But this video just gives you some general guidelines, so when I come and see you in a few minutes, you understand how the carotid ultrasound is being done and what it means to your particular case. Thank you.
When we think prevention, live long, the heart of mid-Michigan strong.